Question 1. A nurse is preparing to administer insulin glargine and regular insulin to a client with diabetic ketoacidosis. The nurse draws both medications into the same syringe to reduce the number of injections. Which action should the charge nurse identify as the priority concern? Regular insulin has a shorter duration than insulin glargine. B. Insulin glargine should not be mixed with other insulins. C. The nurse should administer insulin after meals. D. The dose of insulin glargine is too low for DKA treatment. Answer. B. Insulin glargine should not be mixed with other insulins. Rationale. Insulin glargine is a long-acting insulin that must never be mixed with other insulin preparations, because mixing alters its pharmacokinetics and can lead to unpredictable absorption and severe glucose instability. Question 2. A postoperative client receiving morphine IV every 2 hours becomes increasingly drowsy. Respirations decrease from 18 minutes to 8 minutes, and oxygen saturation falls to 86%. Which medication error is most likely responsible for this client's deterioration? A. Failure to dilute morphine before IV administration. B. Administering morphine through a peripheral IV line. C. Failure to reassess sedation level before repeat dosing. D. Giving morphine with normal saline infusion. Answer. C. Failure to reassess sedation level before repeat dosing. Rationale. Sedation precedes respiratory depression in opioid toxicity. The most dangerous medication error is failure to assess the client's respiratory and neurologic status before administering another opioid dose. Question 3. A nurse administers potassium chloride IV push to a client complaining of severe leg cramps. Minutes later, the client develops ventricular tachycardia. Which statement best explains the medication error? A. Potassium chloride must be given with dextrose solutions. B. Potassium chloride should only be administered orally. C. IV push potassium can cause fatal cardiac dysrhythmias. D. Potassium should be administered before meals. Answer. C. IV push potassium can cause fatal cardiac dysrhythmias. Rationale. Potassium chloride must never be administered IV push, because rapid potassium infusion can immediately trigger lethal cardiac arrhythmias and cardiac arrest. Question 4. A client with atrial fibrillation receives warfarin therapy. The nurse notes an INR of 5.8 and administers the scheduled dose without notifying the provider. Which complication places the client at greatest risk? A. Answer. B. Massive hemorrhage. Rationale. An INR of 5.8 indicates dangerously excessive anticoagulation. Administering warfarin despite a critically elevated INR significantly increases the risk for life-threatening bleeding. Question 5. A nurse accidentally administers rapid-acting insulin instead of long-acting insulin to a client who is NPO before surgery. Which assessment finding requires immediate intervention? A. Blood glucose of 78 mg DL. B. Mild diaphoresis. C. New confusion and tremors. D. Heart rate of 88 per minute. Answer. C. New confusion and tremors. Rationale. Confusion and tremors indicate symptomatic hypoglycemia, which can rapidly progress to seizures, coma, or death, especially in an NPO client who cannot compensate with oral intake. Question 6. A nurse administers digoxin to an older adult whose morning heart rate is 48 per minute without notifying the provider. 2 hours later, the client becomes dizzy and hypotensive. Which medication error occurred? A. Failure to monitor renal function. B. Failure to assess apical pulse before administration. C. Failure to administer medication with food. D. Failure to elevate the client's head during administration. Answer: B. Failure to assess apical pulse before administration. Rationale: digoxin should be withheld and the provider notified when the apical pulse is below 60 minutes in adults, because severe bradycardia can worsen and lead to hemodynamic instability. Question 7. A nurse administers ceftriaxone to a client despite a documented history of anaphylaxis to cephalosporins. The client immediately develops wheezing and facial swelling. Which action by the nurse was the primary medication error? A. Administering the medication too quickly. B. Failure to review allergy history before administration. C. Mixing ceftriaxone with normal saline. D. Administering the medication intramuscularly. Answer: B. Failure to review allergy history before administration. Rationale: reviewing allergies is a critical safety responsibility. Ignoring a documented severe allergy can result in life-threatening anaphylaxis. Question 8. A client receiving heparin infusion suddenly develops bleeding gums and hematuria. Laboratory results show an APTT of 140 seconds. Which nursing action contributed most to this medication error? A. Administering heparin through a pump. B. Failing to monitor coagulation studies appropriately. C. Giving heparin with IV antibiotics. D. Administering heparin subcutaneously before infusion. Answer: B. Failing to monitor coagulation studies appropriately. Rationale: heparin therapy requires close APTT monitoring. Excessively prolonged clotting time indicates dangerous over-anticoagulation and increased hemorrhage risk. Question 9. A nurse prepares to administer crushed extended-release nifedipine through a feeding tube to a client with dysphagia. Which outcome is the greatest concern? A. Delayed therapeutic effect. B. Severe hypotension from dose dumping. C. Mild gastric irritation. D. Reduced medication absorption. Answer: B. Severe hypotension from dose dumping. Rationale: crushing extended-release medications destroys the controlled-release mechanism, potentially causing rapid absorption and profound hypotension. Question 10. A nurse administers metformin to a client scheduled for IV contrast imaging later that morning. Which complication is the client most at risk for developing? A. Hypernatremia. B. Lactic acidosis. C. Severe hypertension. D. Pulmonary embolism. Answer: B. Lactic acidosis. Rationale: metformin combined with contrast dye can precipitate kidney injury and increase the risk of lactic acidosis, a potentially fatal complication. Question 11. A client prescribed fentanyl patches reports uncontrolled pain. Without removing the previous patch, the nurse applies another fentanyl patch. Several hours later, the client is difficult to arouse. Which complication is most likely occurring? A. Serotonin syndrome. B. Opioid overdose. C. Neuroleptic malignant syndrome. D. Acute psychosis. Answer: B. Opioid overdose. Rationale: multiple fentanyl patches can cause excessive opioid absorption, leading to respiratory depression, coma, and death. Question 12. A nurse administers a beta blocker to a client whose blood pressure is 82/50 millimeters of mercury and heart rate is 52 per minute. Which adverse outcome is most likely? A. Reflex tachycardia. B. Severe hemodynamic compromise. C. Hyperglycemia. D. Increased cardiac output. Answer: B. Severe hemodynamic compromise. Rationale: Beta blockers further reduce heart rate and blood pressure, potentially worsening shock and tissue hypoperfusion. Question 13. A client receiving vancomycin develops flushing, hypotension, and pruritus during infusion. Which medication error likely occurred? A. Failure to refrigerate vancomycin. B. Infusing vancomycin too rapidly. C. Mixing vancomycin with dextrose. D. Administering vancomycin intramuscularly. Answer. B. Infusing vancomycin too rapidly. Rationale. Rapid vancomycin infusion can cause red man syndrome characterized by flushing, hypotension, and histamine release. Question 14. A nurse administers insulin lispro, but the meal tray is delayed for 90 minutes. Which complication is the client at highest risk for? A. Hypercalcemia. B. Hypoglycemia. C. Hypernatremia. D. Hypertensive crisis. Answer B. Hypoglycemia. Rationale. Rapid-acting insulin begins working quickly, and delayed food intake can lead to severe hypoglycemia. Question 15. A nurse misreads a prescription for morphine 2 mg as morphine 20 mg IV. Which safety strategy would most likely have prevented this medication error? A. Administering the medication slowly. B. Independent double check of high alert medications. C. Giving the medication with food. D. Using a larger syringe. Answer. B. Independent double check of high alert medications. Rationale. Opioids are high alert medications. Independent verification significantly reduces the risk of dosage misinterpretation and overdose. Question 16. A client taking spironolactone is also prescribed potassium supplements. Which electrolyte imbalance is the priority concern? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypercalcemia. Answer. B. Hyperkalemia. Rationale. Spironolactone is potassium sparing. Combined potassium supplementation can dangerously elevate serum potassium levels and trigger lethal dysrhythmias. Question 17. A nurse administers phenytoin IV push rapidly through a peripheral line. The client develops hypotension and bradycardia. Which statement is accurate? A. Phenytoin must be administered slowly. B. Phenytoin should only be given orally. C. Bradycardia is expected with seizure medications. D. Hypotension indicates therapeutic effectiveness. Rationale. Rapid IV phenytoin administration can cause cardiovascular collapse, severe hypotension, and dysrhythmias. Question 18. A nurse gives an ACE inhibitor to a pregnant client whose pregnancy was recently confirmed. Which fetal complication is most concerning? A. Neural tube defect. B. Renal damage in the fetus. C. Congenital cataracts. D. Hearing loss. Answer. B. Renal damage in the fetus. Rationale. ACE inhibitors are contraindicated in pregnancy because they can cause fetal renal injury and death. Question 19. A client taking MAOI antidepressants consumes aged cheese and red wine brought by family members. Which complication is the priority concern? A. Hypoglycemia. B. Hypertensive crisis. C. Respiratory acidosis. D. Severe bradycardia. Answer. B. Hypertensive crisis. Rationale. Tyramine-containing foods combined with MAOIs can trigger life-threatening hypertensive emergencies. Question 20. A nurse administers opioid medication to a post-operative client without verifying the client's identity. Minutes later, Another client reports severe uncontrolled pain because the wrong patient received the medication. Which national patient safety goal was violated? A. Maintain sterile technique. B. Use at least 2 patient identifiers. C. Document medication after administration. D. Educate the client about side effects. Answer: B. Use at least 2 patient identifiers. Rationale: verifying patient identity using 2 identifiers is a core medication safety standard designed to prevent wrong patient medication errors. Question 21. A nurse administers enoxaparin subcutaneously and massages the injection site afterward because the client complains of discomfort. Several hours later, a large hematoma develops. Which action caused the medication-related complication? Using the abdomen for injection. B. Administering the medication slowly. C. Massaging the injection site after administration. D. Rotating injection locations. Answer C. Massaging the injection site after administration. Rationale: enoxaparin injection sites should never be massaged because doing so increases tissue trauma and bleeding risk, often resulting in hematoma formation. Question 22. A nurse administers levothyroxine together with calcium carbonate during morning medication rounds. Which outcome is most likely? A. Increased levothyroxine absorption. B. Reduced effectiveness of levothyroxine. C. Acute thyroid storm. D. Severe hypercalcemia. Answer: B. Reduced effectiveness of levothyroxine. Rationale: calcium binds levothyroxine in the gastrointestinal tract and significantly decreases absorption, leading to subtherapeutic thyroid hormone levels. Question 23. A client receiving morphine PCA becomes increasingly sedated. The family states they have been pressing the PCA button while the client sleeps to keep the pain controlled. Which medication error occurred? A. Failure to rotate opioid medications. B. PCA by proxy administration. C. Incorrect opioid dilution. D. Improper IV site placement. Answer: B. PCA by proxy administration. Rationale: only the client should activate a PCA device. Family activation bypasses the safety mechanism of patient responsiveness and greatly increases overdose risk. Question 24. A nurse accidentally administers a concentrated insulin dose because the medication was not properly diluted according to protocol. Which assessment finding indicates the most immediate danger? A. Dry mucous membranes. B. Blood glucose of 32 mg per deciliter. C. Heart rate of 102 per minute. D. Mild headache. Answer: B. Blood glucose of 32 mg deciliter. Rationale: severe hypoglycemia can rapidly progress to seizures, coma, irreversible brain injury, and death if untreated. Question 25. A client receiving IV furosemide reports ringing in the ears shortly after administration. Which medication error is most likely responsible? A. Infusing furosemide too rapidly. B. Mixing furosemide with saline. C. Giving furosemide with food. D. Administering the medication through a central line. Answer: A. Infusing furosemide too rapidly. Rationale: rapid IV administration of furosemide increases the risk for ototoxicity, which may present as tinnitus or hearing loss. Question 26. A nurse administers a scheduled antihypertensive medication despite the client reporting dizziness and having a blood pressure of 88/54 millimeters of mercury. Which complication is most concerning? A. Orthostatic hypotension leading to falls. B. Hyperglycemia. C. Fluid overload. D. Hyperthermia. Answer: A. Orthostatic hypotension leading to falls. Rationale: administering antihypertensives to a hypotensive client can worsen cerebral hypoperfusion and increase the risk of syncope and injury. Question 27. A nurse crushes enteric-coated aspirin for administration through a feeding tube. Which adverse effect is the priority concern? A. Delayed medication absorption. B. Gastric mucosal injury and bleeding. C. Severe constipation. D. Reduced platelet inhibition. Answer: B. Gastric mucosal injury and bleeding. Rationale: enteric coating protects the stomach lining from irritation. Crushing the tablet removes this protection and increases bleeding risk. Question 28. A client prescribed lithium develops vomiting, coarse tremors, and confusion. The nurse notes a lithium level of 2.1 MEq per liter, but administers the next scheduled dose. Which medication error occurred? A. Failure to administer lithium with meals. B. Failure to recognize lithium toxicity. C. Administering lithium through a peripheral line. D. Giving lithium with antihypertensive medication. Answer: B. Failure to recognize lithium toxicity. Rationale: therapeutic lithium levels are narrow. A level of 2.1 milliequivalents per liter indicates toxicity, and continuing administration can cause seizures, coma, and death. Question 29. A nurse administers acetaminophen to a client with severe liver failure without reviewing laboratory values. Which complication is most likely? A. Acute renal calculi. B. Hepatic necrosis. C. Pulmonary fibrosis. D. Severe hypertension. Answer: B. Hepatic necrosis. Rationale: acetaminophen is hepatotoxic in excessive doses or impaired liver function, and may precipitate liver failure. Question 30. A client receiving insulin therapy reports shakiness and sweating. The nurse mistakenly administers additional insulin because the blood glucose result was documented on the wrong chart. Which patient safety issue occurred? A. Medication reconciliation failure. B. Documentation error causing wrong treatment. C. Incorrect injection technique. D. Failure to rotate insulin sites. Answer: B. Documentation error causing wrong treatment. Rationale: incorrect charting can lead to inappropriate medication administration and life-threatening hypoglycemia. Question 31. A nurse administers an opioid and a benzodiazepine together without reassessing the client's respiratory status. Which complication is most likely? A. Severe respiratory depression. B. Hypertensive crisis. C. Hyperreflexia. D. Polyuria. Answer: A. Severe respiratory depression. Rationale: opioids and benzodiazepines have additive CNS depressant effects that can suppress respirations and lead to fatal overdose. Question 32. A client taking digoxin develops nausea, blurred yellow vision, and bradycardia. Which laboratory value should the nurse suspect is contributing to the toxicity? A. Potassium level of 2.9 milliquiliter L. B. Sodium level of 145 milliquiliter L. C. Calcium level of 8.8 milligrams per deciliter. D. Magnesium level of 2.0 milliquiliter L. Answer: A. Potassium level of 2.9 MEq per liter. Rationale: hypokalemia increases myocardial sensitivity to digoxin and significantly raises the risk for toxicity. Question 33. A nurse administers cefazolin IV to a client and leaves the room before monitoring for adverse reactions. Minutes later, the client is found gasping for air. Which nursing action failed? A. Assessing IV patency. B. Monitoring for immediate hypersensitivity reaction. C. Administering medication with food. D. Diluting the medication appropriately. Answer: B. Monitoring for immediate hypersensitivity reaction. Rationale: clients receiving IV antibiotics should be monitored for anaphylaxis, particularly during initial administration. Question 34. A client prescribed transdermal nitroglycerin reports chest pain. The nurse applies a new patch without removing the previous one. Which complication is most likely? A. Severe hypotension. B. Hyperglycemia. C. Acute urinary retention. D. Hypertensive emergency. Answer: A. Severe hypotension. Rationale: multiple nitroglycerin patches can cause excessive vasodilation, leading to dangerous hypotension and syncope. Question 35. A nurse administers methotrexate daily instead of weekly for rheumatoid arthritis due to misreading the prescription. Which complication is most concerning? A. Severe bone marrow suppression. B. Hyperthyroidism. C. Pulmonary embolism. D. Acute glaucoma. Answer: A. Severe bone marrow suppression. Rationale: methotrexate dosing errors are highly dangerous. Daily administration instead of weekly can cause fatal pancytopenia and organ toxicity. Question 36. A client receiving total parenteral nutrition is prescribed regular insulin. The nurse administers the insulin after the TPN infusion is abruptly discontinued. Which complication is most likely? A. Severe hypoglycemia. B. Hypercalcemia. C. Hypertensive crisis. D. Metabolic alkalosis. Answer: severe hypoglycemia. Rationale: TPN provides continuous glucose delivery. Administering insulin after stopping TPN can rapidly decrease serum glucose levels. Question 37. A nurse administers ibuprofen to a dehydrated older adult with chronic kidney disease. Which complication is the greatest concern? A. Acute kidney injury. B. Hyperthyroidism. C. Severe bradycardia. D. Pulmonary edema. Answer: A. Acute kidney injury. Rationale: NSAIDs reduce renal perfusion and can precipitate acute kidney injury, especially in dehydrated or renal-impaired clients. Question 38. A client prescribed clopidogrel is also taking omeprazole daily. Which medication-related issue should the nurse recognize? A. Increased anticoagulant effects. B. Reduced antiplatelet effectiveness. C. Severe hypoglycemia. D. Increased calcium absorption. Answer: B. Reduced antiplatelet effectiveness. Rationale: omeprazole can interfere with clopidogrel activation, reducing antiplatelet effects and increasing thrombotic risk. Question 39. A nurse administers rapid IV promethazine through a small peripheral vein. The client immediately reports burning pain and swelling at the site. A. Extravasation injury. B. Hyperglycemia. C. Pulmonary embolism. D. Acute psychosis. Answer: A. Extravasation injury. Rationale: promethazine is highly vesicant and can cause severe tissue damage if infiltration or extravasation occurs. Question 40. A nurse gives a scheduled dose of metoprolol to a client with heart failure despite new wheezing and shortness of breath. Which complication is the priority concern? Bronchospasm and worsening respiratory distress. B. Hypernatremia. C. Severe constipation. D. Acute pancreatitis. Answer: bronchospasm and worsening respiratory distress. Rationale: beta blockers may worsen bronchospasm, particularly in susceptible clients, and can exacerbate respiratory compromise. Question 41. A nurse administers magnesium sulfate to a client with preeclampsia. 30 minutes later, the client's respirations decrease to 9 per minute, and deep tendon reflexes are absent. Which medication error is the priority concern? A. Failure to administer magnesium with food. B. Failure to recognize signs of magnesium toxicity. C. Administering magnesium through a peripheral line. D. Mixing magnesium with normal saline. Answer: B. Failure to recognize signs of magnesium toxicity. Rationale: respiratory depression and absent reflexes are classic signs of magnesium toxicity and can rapidly progress to respiratory arrest if untreated. Question 42. A client receiving warfarin therapy is prescribed trimethoprim sulfamethoxazole for a urinary tract infection. The nurse fails to notify the provider about the interaction. A. Decreased anticoagulation. B. Severe bleeding due to elevated INR. C. Acute hyperglycemia. D. Respiratory alkalosis. Answer: B. Severe bleeding due to elevated INR. Rationale: trimethoprim sulfamethoxazole potentiates warfarin effects and significantly increases bleeding risk. Question 43. A nurse administers insulin to the wrong client after bypassing barcode scanning because the scanner battery was low. Which patient safety principle was violated? A. Time management during medication administration. B. Medication verification safeguards. C. Dietary monitoring procedures. D. Infection prevention technique. Answer: B. Medication verification safeguards. Rationale: barcode scanning is a major medication safety measure that helps prevent wrong patient and wrong medication errors. Question 44. A client receiving IV opioids becomes unresponsive with pinpoint pupils and respirations of 6 per minute. Which medication should the nurse prepare to administer immediately? A. Flumazenil. B. Naloxone. C. Protamine sulfate. D. Acetylcysteine. Answer: B. Naloxone. Rationale: naloxone rapidly reverses opioid-induced respiratory depression and is the priority intervention in opioid overdose. Question 45. A nurse administers a scheduled dose of insulin without checking the client's blood glucose level because the unit is busy. The client later develops seizures. Which medication error most likely contributed? A. Failure to rotate insulin sites. B. Failure to assess before medication administration. C. Administering insulin through the abdomen. D. Using a small insulin syringe. Answer: B. Failure to assess before medication administration. Rationale: blood glucose assessment is essential before insulin administration to prevent severe hypoglycemia and neurologic injury. Question 46. A client taking prednisone abruptly stops the medication after several months of therapy. Which complication is the priority concern? A. Adrenal insufficiency. B. Hypercalcemia. C. Severe hypertension. D. Polycythemia. Answer: A. Adrenal insufficiency. Rationale: long-term corticosteroid therapy suppresses adrenal function. Abrupt discontinuation may trigger adrenal crisis, which can be life-threatening. Question 47. A nurse administers IV potassium to a client with minimal urine output, without reviewing recent laboratory results. Which complication is most likely? A. Hypokalemia. B. Fatal cardiac dysrhythmias from hyperkalemia. C. Hyperthyroidism. D. Respiratory alkalosis. Answer: B. Fatal cardiac dysrhythmias from hyperkalemia. Rationale: clients with poor renal output cannot adequately excrete potassium, greatly increasing the risk for life-threatening hyperkalemia. Question 48. A nurse administers a sedative to an older adult without adjusting the dose for age-related physiologic changes. Which outcome is most likely? A. Increased medication tolerance. B. Excessive sedation and falls. C. Severe hypertension. D. Accelerated metabolism of the drug. Answer: B. Excessive sedation and falls. Rationale: older adults are more sensitive to sedatives because of altered metabolism and decreased clearance, increasing the risk for injury. Question 49. A client receiving chemotherapy has an absolute neutrophil count of 400 per cubic millimeter. The nurse administers rectal acetaminophen for fever. Which complication is the priority concern? A. Rectal bleeding and infection. B. Hyperglycemia. C. Pulmonary edema. D. Severe hypertension. Answer: A. Rectal bleeding and infection. Rationale: rectal procedures should be avoided in neutropenia appliance because tissue trauma increases infection and bleeding risk. Question 50. A nurse discovers that a high alert medication was administered in the wrong dose, but decides not to report the error because the client appears stable. Which statement best reflects safe nursing practice? A. Medication errors should only be reported if harm occurs. B. Reporting errors promotes system-wide patient safety improvements. C. Stable clients are not affected by medication errors. D. Incident reports are used primarily for staff punishment. Answer: B. Reporting errors promotes system-wide patient safety improvements. Rationale: medication errors and near misses should always be reported to identify system failures, improve safety protocols, and prevent future harm.
How many did you get correct? Drop your score in the comments and tell us which medication error nearly fooled you the most. Medication safety is one of the highest tested areas on the Nclex, and in real clinical practice, one small mistake can become a life-threatening emergency within minutes. The best nurses are not the fastest nurses. They are the safest nurses. Keep training your clinical judgment. Verify before you administer. Assess before you medicate. Reassess after every high-risk drug. Never ignore early signs of toxicity. If this practice set challenged your thinking, make sure you like the video, subscribe, and turn on notifications for more pro-level Nclex drills. Share this with another nursing student preparing for success. See you in the next Nclex Mastery session.